Okay. Well, thank you, Natalie, for attending our event. This event will be recorded, so anybody that wasn't able to call in and attend will be able to post on the website and send out in the listserv email. But thank you all for attending, and thank you, speakers, for your work with this event. The APTA Oncology section wanted to host an Oncology Rehab Month event, and what better way to talk about all the pathways to get involved with APTA Oncology. My name is Amy Compston. I am the mentorship director for APTA Oncology. I am one of the rehab managers for our outpatient setting at The Ohio State University James Comprehensive Cancer Center, and I have been there for going on 14 years now. We'll do some introductions with the rest of our speakers, go through some slides, and then we'll leave time for some Q&A. Natalie, please feel free to come off mic and ask any questions throughout. This can be your personal experience. And then anybody else that is watching this online, please feel free to reach out to any of us through the emails that you will see in the slides or the Information Oncology section website. So our agenda tonight is to really have a little bit of a more of an informal conversation of how we all within our leadership positions at APTA Oncology got involved and the impact that it has on our lives. And then talk about the different section areas that anybody can get involved in through APTA Oncology, how you can take those next steps, and some questions and answers. Thank you again to all of our lovely speakers. This event and APTA Oncology would not be what it is without the participation of these amazing individuals, as well as the individuals through the section that weren't able to attend tonight. So thank you all for taking the time to be with us. So how do we get involved in APTA Oncology and enhance or change and how it's impacted or changed our lives? So I'm going to kind of cold call on some of our speakers so they can tell their stories on how they got involved. So Miss Jennifer Bernstein, why don't you tell us how you got involved in APTA Oncology and how it's enhanced your career or has impacted?
Only if you promise to call me Jen, because Jennifer means I'm in trouble. So,
Deal.
Jen only. I'm Jen Bernstein. I have been a physical therapist for a little over 12 years now. My entire career has been at Cincinnati Children's Hospital in Cincinnati, Ohio. And for almost the entire 12 years, I have worked on our hematology, oncology, and bone marrow transplant unit. I do a lot of pediatric and adolescent and young adult physical therapy. So it keeps me very busy. I became a specialist back in 2020. I sat for my exam like 3 days before the world shut down. So kind of got jolted into things and then everything stopped. And I really had to try to figure out a way to stay involved and stay active. I know it sounds so silly, but I was a former sorority president and recruitment chair, and this kind of environment just really makes me thrive. I love it. And so I very quickly started reaching out to some of the people in the oncology section that I had met at CSM, and just kind of starting really quickly, like developing relationships with people, whether they were local or across the country. And I'm sure everybody feels this way about Mr. Scott Capozza, but those who know him love him, and he paved the pathway for a lot of us. And he kind of very quickly early on was like, I think you need to get involved in the section. So honestly, I have Scott Capozza to thank for my time that I've served within APTA Oncology, and then also on the specialty panel, which I'll tell you guys a little bit about as we go on in the webinar.
Thanks, Jen. What about you, Annie? How about how you've gotten started with the section?
Yeah, so my name's Annie. I was in Denver, recently moved to Chicago like a month ago, and I am at Northwestern University medicine. And we are kind of starting a breast cancer rehab program. Crazily, there's not really like a structured program here, so we are hoping to get that off the ground. But I got involved in APTA oncology probably 3 years ago. And I think for me, like I was just kind of starting out in my career in oncology and I wanted to find a way to connect with people, and to really like expand my knowledge. And I just wanted to like kind of dabble and get involved. And I knew Franny, who was our former vice president, and she was like, "Hey, we need an education chair. Do you want to do it?" And I was like, "Sure, I guess I'll just jump in instead of dip my toe in." And it has been such a great experience. I think for me, it's really like empowered me to take this new position that I have now in my career, to understand that I have like support within the section and places that I can go within, excuse me, the academy, places I can go to within the academy, to kind of support what I want to do and what I want to grow, and also this great network of people who have been there before and who I can reach out to for mentorship. So yeah, I'm very grateful to kind of have this support behind me. And I think the other thing, is if you're just kind of getting started, is that everyone here is so supportive and willing to help. Like I can reach out to anybody with any question and I will get an answer. So this is just like a very special group, a very approachable group, that I feel very lucky to be a part of.
Thank you, Annie.
Yeah.
I think a lot of us would echo that as well. And just let's do one more before we move on to some slides. And of course, as you go through your section, please introduce yourself again or firstly to the group. Mary, what about you?
So I'm looking at the screen and I'm the only one with gray hair. So it's kind of scary to me. I've been a therapist.
I pay for mine not to be gray, Mary.
I've been a therapist for 35 years. So I'm on the other end of my career. But I can still say and echo Jen and Annie for things that they've said. Number one, I transitioned from being a clinician to full-time to working in academia. And it was the folks in APTA Oncology who really gave me the support and made me who I am today as a researcher and educator. And I could not have gotten nearly as far as I have today without this academy and the people. When Annie says you can just get answers from anybody, it's true. We are known as the nice academy. When we do our CSM presentations, people are not mean. So we are known as the Friendly Academy. And I remember going to a meeting in the late 2000 aughts, so like '08, something like that, when we were trying to get specialization. And I remember feeling, gosh, this academy is so cool. There's so many neat people here. And it's been a great resource, both clinically because I moved into oncology rehab. I'm an orthopedic therapist, but I moved into oncology rehab and for my academic career. So it's been great.
Thank you, Mary. You said something regarding, you being an orthopedic PT, but in oncology, rehab. I think it is important to note, and we've talked about this as far as an academy as a whole, no matter what specialty someone is going into within the physical therapy field, they're going to run into oncology patients. And so the essential nature of our academy is even more important now than ever before. It's not enough for patients to be cured anymore. We have patients living with their oncology diagnoses for the rest of their life, or they are cured and they are dealing with debilitating side effects. And those patients will go on to live lives and have knee replacements totally outside of their oncology diagnosis. Or they will end up having, unfortunately, maybe a heart attack and have to go see cardiopulm. Or maybe they started, unfortunately, out as a pediatric patient with an oncology diagnosis, and now they are into their adult life. So it is really important, not just for those that are interested in this field because of the passion of this field, but for those that maybe are not going into the oncology practice, but to have that knowledge of when they run into it. Thank you guys for sharing that. I'm going to go ahead and share my screen again. Okay. So how to get involved? There are many different roads and pathways to get involved with APT Oncology. It was one of the things first starting out and my interest in oncology on just where to navigate this. There's so many people going to CSM, attending the oncology lectures, going to the poster presentations. Luckily, trying to find somebody that said hi and then taking me the rest of the way. We wanted to be able to create kind of a roadmap where you can start, you can exit ramp and go on to another route or be involved in all of it. So this hopefully will help you navigate through all the many different areas of getting involved with our academy. So first we have specialization, and I will turn it over to Jen.
Perfect. So, like I said earlier, I'm Jen Bernstein. I have been the specialization chair since this position was created within the academy. So, for the last several years, I've gotten to hold this title, and I am really passionate about it. Specialization is such a amazing thing for us as therapists. It really opens a lot of doors, within our workplace, within the world, research, things I never ever thought that I would be doing, I'm doing now as a specialist. So it's really, really exciting. The goal truly of being the specialization chair or specializing is to promote and support oncology board certification within the academy. So it's my job to reach out to those who have questions about specialization, who want to know more about the timeline. There's obviously things that cannot be shared from a standpoint of this is an exam that everybody takes. And so, yes, I may have some insider information, but it's for me and the panel only. But anything that I can do to kind of help guide you to the right people who may be able to answer your questions, especially within ABPTS, which is the organization that is really in charge of doing some of the specialty board certification exams. That's what I'm here for, to be a motivator, a cheerleader, be a connector. In terms of different types of opportunities, there really is only one specialization chair within the academy, but I could always use support because I have a really hard time saying no to things, and I do a lot of activities for the academy and just in life in general. So different things that would be low commitment that I would always love having help with are things like social media. So sharing your specialization story or kind of a day in the life of a specialist, just being willing to tell a little bit about yourself, coming on to webinars like these and sharing your experiences. We every year at CSM, we support our soon-to-be specialists at our specialization and residency info session. So coming and really, again, sharing your experience, be a support, it goes a long way. Volunteering, it's not on here, but volunteering at the booth at CSM, if you are a specialist or within the academy, it's so nice to meet people and to kind of help them feel welcome and answer some of those questions. So really low commitment. In terms of medium and high commitment, I'm going to talk really quickly about the mentorship program, which you'll hear a lot about, but it's a really nice way to, whether it's with student physical therapists, newly board certified therapists. It's a great way to kind of help coach or mentor them as they are going along this journey throughout, their experience. So I would highly, highly, highly recommend it. And then item rating. And I'll talk a little bit more about item rating on my next slide, but item rating is something that we are desperate for help with. We need people to help us write questions for the board certification exam. So when you are an item writer, and again, I'll talk a little bit more about it on the next slide, there are some workshops that are out there, and there are some different positions that you can hold within the item writing kind of bubble. In terms of time expectations, it's pretty low, 1 to 4 hours per month, depending on what's on the schedule. And that's different webinars, brief meetings, updating social media. You can always contact me if you have any ideas to, engage our soon to be certified specialists or new or even experienced specialists. I'm open to everything. I also always recommend going to the specialization website if you have questions about the timeline, you want some more details. There's a lot of really helpful things on that website. In terms of specialty panel, this is kind of a subset of what I do, and it goes really nicely with being the specialization chair. The goal of the panel is really to develop the minimum eligibility requirements for certification and recertification in a specialty area. So for us, that's oncology, based on the ABPTS guidelines. And when required, we screen different applicants for eligibility to sit for these different exams. So the panel consists of 4 different positions. There's a chair, there's an item writing coordinator, an assistant item writing coordinator, and then a MOSC, which is our maintenance program item writing coordinator. So these positions rotate in and out every couple of years. We should have 1 position open on the board. So or on the panel, if anybody's interested, I highly recommend applying. In terms of commitment, this definitely is a little bit more of a commitment from a panel perspective than compared to something like specialization chair. But again, there are some different levels of commitment. So for example, if you want to be a Specialization Academy of Content Experts, which we call SACE for short, basically that means you're an item writer. You do have to be a board certified specialist. And the requirement is that you submit 10 oncology related test questions per year. The really cool thing about it is there's some monetary prizes available. The amount of questions that are submitted and approved can go towards your maintenance certification application. So again, just a really nice incentive, something that you can take your everyday happenings in your clinic, in your hospital, put it into a question and get credit and potentially money for it. So why not? The other thing that we always ask for item writers is to attend some different item writing workshops throughout the year, but the big one is at CSM. And we offer both in-person and virtual options for that because we know it's hard for people to travel and make that commitment. In terms of the higher, like medium and high commitments, being a clinical content expert, so we call that a CCE. These are the initial reviewers who look at the submitted test items. So if you're a SACE writer and you submit some questions, they're going to go to somebody called a CCE and they will review those questions and then pass them on to the panel. So they're kind of like your really smart middleman who may give you some feedback, some ideas, ways to enhance your question. They're there to help guide you and support you. And then again, you have your specialty panel, which are those 4 positions that I talked about. And that definitely takes a little bit more of a time commitment. So if you're a SACE or CCE member, probably can expect 1 to 4 hours a month. And then for specialty panel, probably closer to 6 to 8 hours per month, depending on the month. We just went through, for the panel, we just went through 6 3-hour meetings 2 weeks in a row, starting to look at the test questions for the next cycle. So we have been busy, but it's fun. We get to learn. For anybody that loves learning, it is such a cool opportunity to get to read questions and just kind of, again, stay relevant in our area of practice. So I obviously could talk about this forever. If you have questions, again, please reach out to my personal email or visit that specialization website via the APTA. It has all of the information that you need.
Thank you so much, Jen. Your energy is always contagious. Thanks for sharing. We'll turn it next to Kayla for residency.
Hello, everyone. My name is Kayla Galt. I am a physical therapist who has now been practicing for almost 6 years, which is wild. I work at The Ohio State University. I was our first oncology resident and then loved it so much that I stuck around. I'm on residency faculty and have kind of moved into this role. So, I started out on this residency SIG as the secretary. Like other people, Scott Capozza was my stepping stone. So he was my mentor in the mentorship program. I had joined it after I completed residency because I wanted to know, like, what's next? Like, I wanted to be mentored in how do I continue in the oncology section. And his big advice was get involved in some way. And so he knew that there was an opening on the residency SIG, became the secretary, and then Jessica Bertram just recently stepped down. So I have stepped into the director role now. So with our special interest group, what our goal is to work with both current and developing residency programs to support whatever their needs are, whether it's they're having difficulty with getting residents or they have questions about like additional mentorship programming and things like that, as well as with developing residency programs, connecting them to current ones to help support them as they have questions about getting ready for their first accreditation or reaccreditation, things like that. And then also serving as the bridge to interested applicants. And so our goal is to just really promote the growth of oncology residency education. We have less than 10, which there are a lot of really good oncology programs doing good oncology things. And so the more that we can promote and help increase oncology education, the better. So that's what our main goal is. As far as opportunities go, we're kind of in a big shifting point because Jessica stepped down. I stepped into my role. Another person left. So right now it's really Athena and I holding it down. Kate Kotian, who is, I think, also on this call, is going to step in as well. And so a really big opportunity that we have if you are interested in getting involved in the oncology section is joining one of the positions. So right now we have the Director of Professional Growth and Educational Resources, Residency Liaison, and Director of Accreditation and Reaccreditation. So we're kind of firming up what we want the SIG to look like right now. And so this is a great way if you have ideas, either you've been involved in starting a residency program or you are someone who has applied and is like, these are the gaps that I see. This is where residency education needs to improve or ways we can support. We are happy to have more friends join us because we can kind of make it whatever we want it to be. The point that we're at right now is we're just getting updated information from our residency programs with regards to their application windows so that we can start working with social media and promoting them. And we're hoping to have our first updated SIG meeting at the end of the summer. Another goal that we're hoping to do is to facilitate a virtual oncology residency fair with the programs as well as potential applicants. And we want to work with social media to promote what's fun and cool about each residency. We want to be a resource for meeting the needs of those programs. So any ideas that you have, any interest that you have, reach out to me at my OSU email. And then I just wanted to also list the current and developing residency programs that we have. So additionally, if you're on the call or listening later on and you're like, oh, hey, I actually have a residency program in development, then reach out about that, as well as if you're interested in developing a program, they're a good resource for you. Thanks.
Thank you, Kayla. It's always nice to see. I get the benefit of being Kayla's colleague at the James at Ohio State, and as one of the adjunct faculty members when she came on as the first resident, seeing how our residency program has evolved over the years, and how we've retained all our residents in full-time positions, and how we've cultivated their personal growth as well as the growth of our department. It's really wonderful to be able to witness that and now see you as part like is involved in the Oncology Academy as much as you are now. So please reach out to Kayla if you are interested in residency or if you're interested in more of a formal role there. I will turn it over now to Amanda. I have the privilege of working with Amanda in our mentorship program as one of our committee members, and it has always been a privilege to work with Amanda and her ability to be involved in many things and wear many hats. So I will pass it off to you, Amanda.
Thank you, Amy. Yeah, it's been really great to get involved in APTA Oncology. I started out actually as a mentee in the mentorship program. All roads in APTA Oncology do lead back to Scott Kaposa. So he encouraged me to get involved in the mentorship program as a mentee. My lovely mentor on this call, Jennifer Bernstein, really just set me up for success getting involved when I thought I wanted to be an inpatient therapist, but then I ended up an outpatient. So, but not because of Jen. If it was because of Jen, I would have ended up an inpatient. So it was really great to get involved as a mentee. And then when there was openings on the student and new professional special interest group, Scott actually recommended that I apply for one. And I had really big imposter syndrome because I didn't have a full oncology caseload at the time. And I was like, really? You think I'm qualified for that? And it turns out fake it till you make it is the motto. So it's been really great to be involved in the students and new professional special interest group. For the last 2 years, I was the director of educational resources and professional growth. So that has been great. And then when our chairs stepped down, they asked if anybody wanted to step up. So myself and Amanda Biebel have stepped up to be the chairs for the students and new professional SIG. I'll just start calling it the SNP. It's kind of a mouthful. We also have one of our new e-board members on here, Lauren. So we just had our first e-board meeting last night. We're really excited to start some initiatives. And so our main goal is to be a very low barrier to entry for students and new professionals that just want to dip their toe in APTA oncology. They want to see what's going on. Maybe not people that are super committed to specializing yet. Maybe they're just students that are interested in it. We also have a few residents involved and also people that have been working in oncology for a little bit, but just want to be connected with students and new professionals. So it's a really great cross section of people that are just curious and also people that are established in it. So that's been really nice to foster the development of that. So we have had a few webinars in the past, and they're actually posted to our YouTube if anybody is curious about watching them. We've done some on lymphedema, on pediatrics, on hematology, oncology. We have 2 webinars coming up that we need to plan. We're going to do a rural health oncology webinar. And then also at CSM, I spoke with somebody that does canine physical therapy, and she wanted to collaborate and do a webinar. So those are very exciting webinars that we will have before the end of the year. And we are also very excited to start a journal club. So in our e-board meeting yesterday, talking about opportunities to get residents involved with the SNP, and then also just give people in the SNP an opportunity to host a journal club to keep us up to date and talk about new and exciting research. So we're really excited to start with that. So if anybody is interested in hosting a journal club or knows somebody that would be interested in that, that is a low commitment thing to do. Also, we are always looking for cool webinars to host. So sometimes we'll have somebody host one of those with us, somebody that has a lot of experience in oncology and wants to share. That has been a great way to get involved. We have a social media page, which is where we do most of our communication with our members. And if anybody has any questions, you can always email me or send a message on our Instagram. So,
Thanks, Amanda.
yeah.
I always learn something new from all of you, all of you speakers, and hearing about the rural health webinar is really interesting. Being from West Virginia, that's definitely a topic that I definitely would love to listen and attend that webinar. So wonderful ways to get your foot wet, if you will. I like to personally, and I tell my staff and my students, if you're able to like build upon the building blocks and think ahead. So, for example, when I hear Amanda speak about the journal club, well, that journal club and learning through the journal club is leading to then potentially all of that knowledge translating to possibly specialization or translating to being a resident in a program. So, how do you utilize one stepping stone to almost take advantage of then all the other stepping stones that you may end up going after? So, thank you, Amanda, for sharing. And then I will hand it over to Annie.
Hello, everyone. In case anybody joined late, my name is Annie Fleming. I am a physical therapist now at Northwestern Medicine, and I am the education chair. So I've been the education chair for about 2 years, and we are really still in like a building phase. Chris Wilson, our president, likes to say that we're such a new academy that we are kind of building the bridge as we're walking across it in the best way possible. But I think that's kind of where we're at with education. So our goal is to collaborate with experts to provide educational opportunities for rehab professionals. So we are really working right now to build up our repertoire of virtual courses and try and get some consistency with a webinar series. So this year we are sponsoring an expert webinar series. You might have seen some little marketing flyers for that. But it's titled Optimizing Bone and Musculoskeletal Health in Oncology, an Interdisciplinary Webinar Series. So we're really excited about this. This is the first year that we've been able to get that off the ground, and we're looking to do an expert webinar series every year. This one in particular is in collaboration with Dr. Wittstein, who's an orthopedic doctor actually at Duke. And there's going to be some oncologists from Duke who are joining some of the later sessions as well. So we are also working on an advanced competency in oncology rehabilitation. That will hopefully be out by the end of the year. So if you're looking for a way to kind of advance your knowledge, that particular certificate will have courses in various domains, musculoskeletal, cardiopulmonary, multisystem lifespan. I think that there's 6 total, and each of those 6 domains will have a course that is presented by experts, some of which are on this panel right now. And then some types of opportunities if you're looking to get involved, low commitment, attend some of the webinars or look at some of the virtual courses. There are some regional courses that happen throughout the year as well. Those are all posted on the APTA Oncology website, and then they are also included in the newsletter. So if you're looking for any sort of advancement in like education or some CEUs, I would highly recommend that you subscribe to the newsletter if you are not already subscribed. There's also a lot of the flyers that go out on the APTA Oncology Instagram too, so that's a good place to keep your eye on as well. Medium to high commitment. So if you're looking for more of like a leadership position, we are really building our committee right now, speaking of building the bridge and walking across it. So we are looking for some people to join in and help to lead some of these initiatives. a social media liaison just to help with developing some of the marketing material, flyers, try to get the word out a little bit more for some of our virtual courses. A webinar coordinator. So right now we try and meet with the presenters for these webinar series to collaborate, make sure the expectations are set, and then also just trying to recruit experts to be able to speak on these topics. So if you're interested in that, if you are good at cold emailing people, that's a great skill and we would love to have you. A CSM liaison. So something else that we've been doing over the last 2 years is repurposing some of the recorded CSM presentations so that if you don't attend CSM and you're not a part of On Demand, or maybe you just want to see one of those courses that was presented at CSM, you don't want to buy the full package, that we have that on the APTA Oncology platform. I think like at least 75% of last year's CSM is available for like each lecture can be purchased individually. But that requires some effort and some contracts to be signed. So if you're interested in being the CSM liaison, that just means that you're working with the CSM presenters to get some paperwork done, so that that virtual session can be repurposed for the academy. And then a virtual course liaison. So similar to the webinar coordinator, just working to recruit oncology experts to give those virtual course presentations. Those virtual courses can be live or they can just be recorded. The time commitment, so depending on what you're interested in, it can be 1 to 4 hours. I feel like a lot of people have said that, so it must be pretty standard across the board. But depending on the month, it can be a little bit more or a little bit less. So it's really kind of what we're making it. So if you're interested in making this what it can be with me, I'd be happy to have you reach out. My email is listed there below. I'm also happy to discuss any new ideas that you might have for educational opportunities. I think that this is something that a lot of our membership has really wanted to be more well developed. And so if you have any ideas, I'd be happy to hear them and develop them with you.
Thank you so much, Annie.
Yeah.
This is definitely an essential area within our academy. And like we've talked about, building the bridge as we're walking across it, building upon those building blocks as you look forward, attending the webinars or going to the courses, or if you are a resident in a residency program and you have to put forth conference presentations, those are really great ways to give back to the academy by just turning that over. And there's also, correct me if I'm wrong, Annie, there's some sort of fiscal incentive as well, possibly by doing that, which is
If you're a presenter, there's an honorarium of $165 per hour, per speaking hour. So not content development, but per speaking hour, yes.
so it's another great opportunity. So please feel free to reach out to Annie.
Yeah.
So there were the virtual and regional courses that she mentioned and the links to that. And then this is me. For those of you that may have joined a little bit later, I'm Amy Comston. I'm the director of the mentorship program for APTA Oncology. I am one of the outpatient rehab managers at OSU James Comprehensive Cancer Center. So the mentorship program, very similar to some of the other programs that you've already listened to, we went through a rebuilding phase a year and a half ago, maybe it's going on 2 years, to revamp the mentorship program. There's a lot of feedback over the past couple cohorts that we wanted to improve the program and deliver what our mentor and mentees want. So the mission of the program is obviously to advance the field of oncology rehab by fostering the relationships between students, new and experienced oncology rehab professionals. This is our leadership group. This is one of the most rewarding groups I have been a part of working with over my career. they're just some badass women to be working with. And it's an honor to work alongside them. Alina Hedaya also wears another hat within the academy. She is the membership chair. She couldn't be with us today, so I will be presenting her slides. And then you already got to hear Amanda. So for mentorship, the mentorship program, it's kind of one or two options. You can enroll as a mentor or you can enroll as a mentee. We do have a virtual CEU mentorship course that Holly developed and got CEU credit for. There are mentee and mentor resource materials to support both individuals in that journey with that relationship. And it's a matching of a 6-month cohort. So the time commitment, we just sent out a recent survey to our mentors and mentees regarding their feedback, how often they met, what platform did they meet on, so on and so forth. So on average, most people met one time a month for a virtual meeting of 1 hour. But it is to be determined by the mentee and mentor pair on what frequency is most appropriate based on the goals. So this is the program structure. If you were aware of the mentorship program in previous years, it was a 1-year commitment. And that's a big commitment for a mentee or a mentor, especially with things ever changing within our careers or within academia. If you hold an academia position or if you're a student. So we decided to turn it into 2 6-month cohorts. So you could sign up for just one cohort as a mentor or mentee. So we split it up into a fall winter cohort and a spring summer cohort. The mentor, in order to be a mentor, you have to have 1 year of clinical experience and a member of the APTA Oncology section. For a mentee, you could be a student or a new professional with less than 0 to 5 years of, or just new to the oncology practice in general and looking to gain more knowledge, or potentially just gain more relationships within our academy. This is the timeline on what those cohorts look like. So very much like the involvement in the other groups that you've already heard of, the time commitment with involvement in our committee ebbs and flows throughout the year. And then the time commitment would depend on which cohort you were paired with. So you can see there, we are coming up. So our committee is coming up to pairing season for the next cohort. So that would be the fall winter cohort that we will be preparing to match. In order to sign up, you can go to the APTA Oncology website and submit the survey for which category that you would want to participate in. Here are some personal testimonies from some of our mentees and mentors that I wanted to highlight. It really speaks volumes to the benefits of going through the mentorship program, whether it is via a mentee or whether it is via a mentor. There is a lot to gain from being a part of the program. Switching gears here, so going from mentorship into this transition of membership. So we would love to continue to keep our mentees, almost like keeping our oncology patients and taking care of them throughout the continuum, as well as our mentees through the continuum of their professional growth. So going into membership and outreach, like I said, Alina Hedaya is the chair of the membership committee, and I'm happy to present these slides on her behalf. But you can see our membership involvement split within the physical therapy, PTA, and students. You can see the majority of our APTA Oncology members are students. And so we want to be able to cultivate and support those students, like I said, going from academia into that mentee through mentorship and on through membership and community outreach. So the goals and the committee focus, Growing, engaging, and retaining. So reaching students, residents, and early clinicians, increasing the awareness of the APTA Oncology community, engaging to create meaningful volunteer opportunities and help members find a place in the section. Retaining and building those lasting relationships through mentorship, networking, volunteering, and recognition. And you can see there the lovely committee members for this group. Alina wanted us to highlight an article, an insight from Bentley University in spring of 2026 that oncology rehab is a strong clinical foundation and growing demand, but suffers from low awareness among students, clinicians, referral sources, and the public. So this kind of comes full circle to what we talked about in the beginning, where no matter what area that you are practicing in within the physical therapy field, you're going to run into oncology. And so, how can you be a better clinician to support your patients? So, please join us and put forth any ideas into action. They are looking for student recruitment and early career development. There's opportunities within cross collaboration with larger APTA sections, public awareness, as well as the social media presence, and enhancing that volunteering and membership engagement infrastructure. And then lastly, I will pass it off to Mary Fisher for research.
So I think this is kind of neat because I think research ties into everything that we've already discussed, and I don't know if it was intentional that I'm last, but I think it's nice. Um, Mary Fisher, University of Dayton. I'm a professor. I've been there for 18 years. I can't believe that either. Um, as I mentioned earlier in the webinar, I originally started just attending meetings, and then I started volunteering for projects that were announced at CSM and was taken under the wing of Cindy Falzer. And I don't know if everyone knows Cindy. Cindy is a force of nature, and has really moved this academy from a itty bitty little bodunk newsletter group of people who treated people who had cancer into this amazing professional organization, and I miss her every day. Um, she passed away in December, for those of you who don't know. Uh, Cindy, I just kept getting involved. I was a secretary for the academy, and then Cindy said, "Hey, Mary, will you work with me on the journal?" And then she said, "Hey, Mary, will you take over as editor-in-chief? I'm going to pass the torch." So my role currently is that I am editor-in-chief of Rehabilitation Oncology. And I've been doing that since 2020. It was so fun to take over in the middle of COVID. But when I think about research, I think about two aspects in the academy. We've got our research committee, on which I serve, and then we have our publications. So the research committee advances oncology rehab research through CSM abstract review, grant funding, and targeted projects, and I'll talk about that in a bit. And then we have two different publications through our academy, which I'm very proud that our small, tiny academy actually has two different publications. We have Rehabilitation Oncology, which is a peer-reviewed publication, and we have Oncology Rehabilitation in Practice, which is more of an editorial board reviewed publication. So if we look at the research committee, Andy Ray is our current chair. And I've listed all the members there in case anybody wants to reach out to anybody. I serve on that committee as an ex officio member because I'm the editor-in-chief. The research committee, one of the big things they do is the abstract review for CSM. We do all the poster and platform abstract review by our members. It happens in July and August. I've got a green star because that's a very low commitment. I usually have to review 20, 30 odd abstracts, and it takes me less than an hour. It's pretty clear cut, not a lot of work. We have a grants program. Anne Marie Flores is the grants coordinator. We don't have one offered this year, but when we offer our grants, we open the application process. I've been involved in this as well. It's coordinating it, and there's grant review involved and scoring. we've moved that process under Melissa Eden from a very poorly structured process into a really nice first time grant writing opportunity for people who then may want to go for bigger grants. It mimics NIH grant writing, but we're not, of course, as strict as NIH. So another opportunity for involvement that takes a little bit more commitment, but not a huge commitment, is reviewing those grants and scoring them. And then there are special projects, and they vary from year to year. I've been involved in a couple, but our current special project is a modified Delphi study and a systematic review to establish a contemporary oncology research agenda. And that is taking hours and hours of work. And by hours and hours, I'd say it ebbs and flows. But I'd say at least 5 hours a month, maybe 10. And I think as we get closer to the point of writing this, it'll even be more. But there are neat opportunities to be involved there. When you look at publications, as I mentioned, Oncology Rehabilitation and Practice is an editorial board reviewed journal. It is hosted by the University of Dayton, which is kind of nice. It's free, it's open access. The editor-in-chief is Brian Spinelli, and he actually sits on our board as well, on the Rehab Oncology board. He's got 2 associate editors, and he's got 3 board members. How do you get involved in that? I really recommend reaching out to Brian because he might look for reviewers, but you could write a research roundup. If there's a topic out there that we haven't talked a lot about and you want to speak to the clinicians about the latest research, you can write a targeted research roundup. They're usually only 1,500 words, so they're not that hard to write. You could write a clinical conversation. What are you seeing in the clinic that it is contemporary practice that might not yet be in the research literature? Something new that came your way. You can put together a clinical conversation. You could, if you're a resident and you have to write case studies anyway, you could write your case study for publication in Oncology Rehabilitation and Practice. That takes more commitment. Contrasting that a little bit with Rehab Oncology, we have as a peer-reviewed journal, and everybody wants us to be indexed in Medline, which I can spend a whole hour on telling you how difficult that really is and how unclear that process really is. We focus exclusively on research, and one of the decisions we made 2 years ago was to move the research roundup and clinical conversation out of the journal because it's not a newsletter for the organization, which it used to be. It's a true blue scientific journal. So that's when we spawned the Oncology Rehabilitation and Practice Journal to pick up that slack. So we have associate editors that oversee different areas of research. They're experts in those types of research design. We have board members who do special other projects for us, like our podcasts, our Onco Reads, digital media presence. We have a statistician, and then we have 3 additional board members that assist us. So how do you help? How do you get involved in rehabilitation oncology? A moderate lift might be helping with that social media. So McKinsey is a new digital media editor, and she works overseeing podcasts and Onco Reads and kind of getting it together and getting it out. But what we need is a stronger social media presence to direct people to all the resources that we have. We could use help in writing Onco Reads. Jill Binkley is the editor overseeing that. She picks an article every issue. Somebody's got to read it and write test questions on it. And it's a quick 1 hour or 2 hour Con Ed opportunity. And then a little bit more commitment is becoming a reviewer. And there's a little bit of training that we can offer folks for becoming a reviewer. We never have enough reviewers. We're always looking for more reviewers. So that's a great way to get involved. Other options that I just kind of want to mention would be, oh, there they are. Nope, I guess they're not on there. Other options might be clinical research. If anybody's in the clinic and says, gosh, this is really cool. I want to do some research on it. I think there's a way to partner with the research committee to then partner with an academic institution to help people actually take their clinical ideas and make it into a research study and see what happens. I think that would be a great idea. Of course, that's a heavier lift. And then there may be one-off special projects. Laura Gilchrist, who's the a senior editor, she oversees a lot of the CPGs, and there may be some special projects that people can get involved in, and that's probably a moderate level lift as well. I think those are the ways that we serve our community. But again, when I think back to education and I think back to the student and new professionals and I think back to the residency and I think back to the mentorship, research is an opportunity to be woven into each and every one of those areas.
Absolutely. Thank you, Mary. I remember, I'm going to stop sharing here. I remember getting rehabilitation oncology, uh, the paper publication when it was coming in the mail, and this would have been, oh, I don't know, maybe 10 years ago. And this was when I'd got my foundation of my PT practice within oncology. It's like, okay, I feel like I got a good handle on it. I want to get more involved. Like I want to do bigger things. And I remember opening the front cover and seeing all these names and seeing credentials behind these names and looking for common themes. Like, okay, if I want to be here, these are the credentials these people have. And seeing names that I continue to see throughout the publications over the years, and then getting to meet Mary Fisher in person and getting to meet Lori Bowright in person and getting to meet Cindy Falzer in person at CSM. I don't even know how to describe that, but I vividly remember opening that publication and be like, okay, I want to be that. I want to be where they are. And through learning all of the different roadmaps into the world of APT oncology, I'm so proud to say that all of those people that I read those names in that publication that I thought, oh my goodness, like these are the people within the academy, and now being able to call you all and all of those people their friends and colleagues just through taking that first step of getting involved. Um, my uh, my husband and I share a passion for just leadership and coaching, and we often talk about the sense of overwhelming decisions, whether it's with staff or our coachees, and the phrase we use is, okay, you're getting overwhelmed with just the thought of cleaning the house. You got to just take the vacuum out first. Just focus on taking the vacuum out first. Don't think about everything that comes with cleaning the house. And I think about the involvement within the academy in those kind of same ways. So hopefully, those who have attended and those listening or watching this um, through online can have some sort of roadmap route of all the ways that you can get involved with the academy or learn and utilize the resources of the academy. And as you've seen, they all overlap, um, but they all lead to a wonderful and beautiful place with the relationships that are formed with us within this field, but also with our patients. So we have some time left in our meeting tonight to leave room for question and answers for those that have attended. So if you want to come on screen, please do so. If you want to throw the question in the chat, or if you just want to come off mic, we will leave room for you now for that.
Amy, if I could just add one thing. Um,
Yes.
you mentioned seeing all those names, and I kind of had that I had that imposter syndrome. I had that I'll never be there syndrome. I can never do what they do syndrome. I had it all. And the one message I want to articulate is when I said we were the friendly academy, we're not just friendly. We are here for everybody's success. So if you have something that you want to do, there is someone here who's going to help you reach that goal.
Absolutely. Thank you. Thank you for saying that. Okay, those that have found the passion to tune in and to come on, um, what questions do you have for us? Or maybe you just like to tell us what drove you to coming to tonight's event. And I will cold call people.
I can go ahead and ask a question. First, thank you all so much for your time tonight. This has been a really cool learning experience. I'm a second year PT student, and kind of ever since I've started PT school, I've been like really drawn to the world of cancer rehab and the opportunities within that as a student PT, and then kind of looking towards the future. So I guess kind of a question that I had was I've been kind of doing some research on residency programs and kind of that route to be specialized. And I've been just kind of thinking about like the option of like going into the field and learning a little bit and having a like job as a PT first and then going into and applying for a residency or kind of if like I know for sure that this is what I want to specialize in, kind of going straight into a residency program. So I was just kind of wondering, like, if how much of those two routes do you usually see? If you have any like pros and cons or like big decision factors you think should play into like which one maybe would be the best route. Yeah, that's what I'm kind of thinking about right now.
I'd love to hear Kayla's answer to this, but I'd also love to hear Lauren, who is on the call, because she is our current resident at Ohio State's James Comprehensive Cancer Center. So I think that could give you two different perspectives potentially.
Um, from the like residency faculty standpoint, I would say either option is a good option. For myself personally, like I will lose momentum. And so I think if I had not gone straight into residency, I would have had a hard time like working and then coming back and then having to spend extra time like prepping presentations and studying for exams and preparing for this big board exam. But that is me as a human being and knowing myself very well. For our residents, we've had, oh my gosh, we've gotten so many residents now. We've have had two that have been working PT providers and then have come back to residency after kind of figuring it out. And then the others have gone straight into residency from being new grads. So it's really kind of half and half how you function. One doesn't necessarily advantage you over the other from a residency admissions perspective. I think getting involved with the S&P SIG is a really, really helpful thing for setting yourself up for any type of going into oncology. You're preparing to apply for residency, but yeah, there's not a hard and fast answer for that.
What's your
Yeah.
take, Lauren?
Hi everyone. I'm Lauren. I'm the current oncology resident at The Ohio State University. So Natalie, I totally get what you mean. I was just in your shoes probably like a couple of years ago thinking like, oh wow, I think like working in the cancer realm is very fascinating and I felt very drawn to it. But I remember as a student, I didn't really know which way to go. I think one of the first things to realize though there isn't really a wrong way to go about it. There are people that go about and specialize and pursue residency and they want to continue on, just as Kayla said. I was kind of also on the same boat as Kayla, where I'm just like, well, I got the steam, just got to keep on going. So I really took advantage of that, but also know that there are other ways to get involved in the not only the academy, but just like working with cancer care. And I think a big question that you really have to ask yourself when it comes to specialization, I was like, yes, you get the fancy letters at the name. Yeah, you get a whole lot of knowledge, but what is it that you actually want to do with that? There's a In my opinion, there's a difference between specialization and just working in cancer care and working with cancer patients, because the knowledge and the background that you have to actually support and I guess grow the profession like exists in both, but in different aspects as well. I think that also the question of to specialize and not to specialize is very person dependent. In terms of life, family, what you have going on as well. And unfortunately, I don't have the answer or crystal ball for you. But I think that, like, when answering that question for yourself, you have to think about not only the um, parts that are important to you as a professional and like a person who's growing their career, but also as a person and what aligns with your values and how you want your life to play out. So.
Thank you, Lauren. Mary, you had your hand up.
And so I think I can't tell you whether or not you should do residency, but I think it's really interesting. You should have asked that question. And I think that Lauren actually hit a lot of the points. This just came up in discussion in our program. As a educator for the last 18 years, I have seen our profession move toward specialization, and I support it wholeheartedly. My answer to that is, don't you always want to know who the therapist is, who does ABC the best? So I 100% support specialization. We had a advisory board meeting, and we had our residency program director speaking. We just started a sports residency. We got accredited. We're excited. And then we had somebody else who said, I never wanted to go through a residency. I just wanted to learn it myself and take the test. And he was successful, and nothing wrong with that path either. But what came out of that discussion was know yourself and understand, is it the mentorship you want? Because that's the added benefit of doing a residency. Getting the knowledge can take lots of different forms and methods, but if you want that mentorship, the residency is the way to go.
I think Amanda and then Kate, you guys had your hands up. Anything to add there?
Yeah, so I just wanted to add a little bit of my perspective as somebody who just took the board exam and passed, yay. So I was in a similar situation as you, Natalie. When I was coming out of school, I was like, okay, I love school. Like, I could do school forever. I would love to specialize in oncology. And then, kind of like you were thinking, I was like, okay, well, I could go out and practice for a little bit, not because I didn't know if I wanted to do oncology, but just to like get some experience, um, and then go from there and decide if I wanted to do residency or not. So I actually ended up doing the non-residency route, and I got the 2,000 hours in the oncology population, and got great mentorship and everything. And then ended up taking the exam, did a study group, have been involved in the student new professional organization. Like I said, I've done the mentorship program. I had two awesome mentors. Um, and on the other side of that, because I'm so passionate about oncology, like I would now love to like get involved with like a residency program, right? Like as a specialist. So I think there are many ways to go, and like everyone's been saying, it's kind of individual. And then as somebody was saying before, if you want to explore more of that and talk to people who've done either or, it's definitely a good idea to get involved with the Students and New Professional org.
Thanks, Amanda. Kate, you also bring a really unique perspective that could really help round out the answer of Natalie's question.
Yeah, so I actually worked for 5.5 years, almost 6 years before I started residency. I worked in ortho, a clinic that also did neuro, and also acute care. So I kind of did everything because I felt like I wanted to learn everything. And that's one of the things that I actually love about oncology is you can do all of those things and it still be oncology. So if you're like, I want to learn about all of these different things, well, oncology is kind of perfect because you're going to do neuro, you're going to do ortho, you're going to do acute care, you're going to make yourself into an OT and have OTs become PTs, and it's going to be fantastic. But I would say from my perspective, I think it was fantastic to do the residency, even with years of practice under the belt. I really learned so much, and I have amazing colleagues who I still learn a lot from. Um, but one of the hard things for me is I'm a really bad test taker, and I am quite terrified of the specialty exam. And I had a really good reason this year not to take it because I had to have surgery. So I avoided it for a year, but I need to take it next year. And I'm still terrified about taking an exam because it's something that I'm just bad at. So if you're like, I love the momentum of having taken exams and knowing how to take exams and remembering how to take exams, that would be like my one piece of like, go try to do residency so that you don't forget how to do that. But if you're somebody who's always been a great exam taker, explore the world. It's it's for you, man.
Thank you, Kate. Natalie, I hope that was helpful.
Yeah, it was super helpful. Thank you all so much.
I'll add I'll add one more thing just to kind of add to your point. I think thinking back on one of the best things that I could do as a student in your shoes is go to CSM. It's where I network my butt off, even though I'm a little shy girl. So, but I networked my butt off. I got in contact with some of the residencies that were across the board as well. I got involved in the SIGs and got to talking to people there, and it's a great way to get your name out there, but also to see what the field has to offer and learn from that. Because in PT school, oncology care and education on that, it's there, but it's limited. So, like, that was one of the places that I really got to experience. Okay, what does that look like from a career perspective? So, it's very eye-opening. Highly recommend you go to CSM when you're a student.
It's a great point, Lauren. I remember when I went to my first CSM many years ago, and I was the only one from Ohio State's Cancer Center, and I went as an attendee. I think I was like only 2 years into my practice, and similar to the story of looking at the publication, I'm looking at all these people deliver these platform presentations, these posters, and for me, it was I I want to do that. Like I want to be up there someday. And it was going to the Celebration of Life event at CSM. That was my introduction, and it was um, someone coming up to me and just introducing themselves and then them asking me like what was my interest in oncology, and I told them, oh, well, I'm really interested in these areas in oncology, and they said, okay, you need to meet so and so, let me go introduce you, and then it all is stemmed from there. So that's a really another great place to start.
I think one of the really awesome things to note also for students that may be watching this, or for Natalie or anybody else on this call that's a student, is membership for the oncology section is free for students. So it's a really, really awesome way to get access to research and make connections and learn so that you have some of the answers to these like bigger questions when you have to make these big decisions. So I would highly encourage, if you are a student and watching this, go ahead, sign up for free membership. Nothing is free anymore, so take advantage of it.
That's a great shout out, Jen. Thank you for reminding us of that. We are at time, but please, if you have other additional questions or other interest areas, for those on this call or for those that may be watching the recording later on, please do not hesitate to reach out to any of us. And if you're not sure who you should talk with, just start with one and we'll guide you through it. So thank you all for taking the time as speakers to present. Thank you for those who have attended the event and who will be watching online. And hopefully we will see more of you in all the other areas that we are involved in as an oncology academy. So thank you, everybody. Have a good evening.
Thank you.
Thanks, guys.